Tell us a little bit about yourself.
My name is Vivek Mendiratta, and I'm one of the second-year gastroenterology fellows at Henry Ford Hospital in Detroit. And today I'm excited to give a brief commentary on behalf of my co-author on our article titled Multidisciplinary Management of Hepatocellular Carcinoma.
So what exactly does the multidisciplinary management of hepatocellular carcinoma entail?
Well, we know that hepatocellular carcinoma is one of the fastest growing causes of cancer-related deaths in the United States. And as such, it presents with a unique set of challenges in both diagnosis and treatment. It requires a multidisciplinary approach with the expertise of physicians from numerous subspecialties, including diagnostic radiologists, pathologists, hepatologists, hepatobiliary surgeons, radiation oncologists, interventional radiologists, medical oncologists, and palliative care specialists alike. Determining the most effective treatment is really not so simple. It often requires a complex interplay of factors such as tumor size, number, and location. And even more confounding is the addition of patient-specific factors, including their liver function and performance status. Even though two patients may have the exact same stage of HCC based on BCLC staging system, their treatment is not infrequently entirely different. That is why a multidisciplinary approach to management is so essential.
What does multidisciplinary management look like?
The idea is to have a streamlined and efficient process that minimizes delays in diagnosis and treatment for patients. The standard method of care has always been this idea of sequential care, whereby a patient has serial referrals in a stepwise process. They may see their hepatologist who tells them they need to review their case with the radiologist, then they are referred to a medical oncologist or interventional radiologist or radiation oncologist, and this whole process can sometimes take months. The counter to this is a multidisciplinary care model. While many of these models exist, the most common one involves tumor boards. A tumor board is an in-person or virtual meeting at a regularly scheduled date and time, where each case is discussed in real time by the multidisciplinary group mentioned earlier, including but not limited to hepatologists, interventional radiologists, pathologists, surgeons, oncologists, and radiation oncologists. And the goal is that everyone comes together at this one specific time to seek the expertise of all of these subspecialties to determine the best treatment option for a specific patient, thus reducing the delays in treatment.
Is there evidence to support the benefit of multidisciplinary management?
Yes, there is. We have long thought that involving physicians of multiple disciplines in a patient's care is beneficial, especially with cancer care, given the rapid advances in the field of oncology. An increasing amount of emerging data has shown the benefits in hepatocellular carcinoma management using this multidisciplinary approach. For instance, one recent study out of the University of Wisconsin showed that patients discussed at Tumor Board had a significantly improved likelihood of timely treatment, overall survival, disease-free progression, and higher likelihood for definitive treatment such as liver transplantation. In addition, one study from the University of South Carolina showed that Tumor Board often leads to changes in diagnosis and radiology interpretation. They showed that new findings were seen on imaging in 61% of cases discussed at Tumor Board, of which 22% were considered major discrepancies that would change overall recommendations.
Are there any other benefits?
Not only have studies shown improved management of these patients and reduced complications, but they've also shown a positive impact on patient satisfaction, specifically in communication and physician confidence.
Thank you very much.